Hi, my name is Randall Alan Loy, and I'm a reproductive endocrinologist in Orlando, Florida. And I want to thank you so much for joining me today. Today we're going to be talking about the Hysterosalpingogram. That's a mouthful. We typically call it the HSG. Hystero means uterus, and salpinx means horn, salpinges, the little fallopian tubes coming off of the uterus. Now, it's a difficult thing to say, and I've had patients who've called up and said, hey, I'm ready to schedule my hysteroparallelogram, or my hysterosalpingogram, or my histrionocogram. Just say HSG and your doctor will know exactly what you need to schedule. So today I'm going to show you how we perform an HSG and what sorts of information we can get from it. So we typically will place a little balloon catheter. It's soft and fairly flexible, and we place that, and by the way, the uterus is not this large, not drawn to scale, but we inflate this little balloon that will then stay inside of the cervical canal. And as that balloon is inflated, we take contrast that looks very much like water, and then we basically just insert that up into the uterus. That is going to fill the uterine cavity and go into the fallopian tubes. Now, what sorts of things will the HSG help us with? Well, sometimes there are polyps inside, fleshy overgrowths of the lining. Sometimes they're little mushroom-shaped overgrowths. Or there might be a smooth muscle cell tumor, a fibroid growing from the wall of the uterus into the cavity. We might also see congenital defects of the uterus, such as a so-called uterine septum that can increase the risk for miscarriage. In addition to showing things about the uterus, we learn about the fallopian tubes. Now, if a fallopian tube is blocked here, we're not going to see it at all. But if it's blocked out towards the end, a ballooned out tube, it may look like that. And that could be a fluid-filled tube called a hydrosalpinx. If we find a hydrosalpinx, it may be necessary for your doctor to remove that before going on to IVF, because this can decrease your chances for having a baby by about 50%. If a tube is blocked here, your doctor may be able to open that through an X-ray procedure or through a hysteroscopic procedure called tubal catheterization. Now, what we're hoping to see is a fallopian tube that comes out like this, and so the dye will come up through the uterus and through the fallopian tubes and spill readily among the bowel loops. That should take just a couple of seconds to see. This is a quick and easy procedure taking 2 to 5 minutes to perform. There's a lot of bad information out there on the internet, and very, very commonly we have patients who have major apprehension going into this. Don't be afraid. If you have fear, talk to your doctor. He or she may want to prescribe a non-steroidal anti-inflammatory drug like ibuprofen or Aleve. Maybe an antibiotic will be prescribed as well. If you're really scared, you might even be prescribed Valium, but you really shouldn't take Valium and try to drive yourself home. So what are the risks of this? There's less than a 1 in 100 chance for having an infection, and that's why we routinely prescribe an antibiotic before this procedure. Tell your doctor if you might have a current or past pelvic infection. You may be treated with antibiotics differently. Also tell your doctor if you're allergic to iodine, because that fluid, that contrast, contains iodine. Tell your doctor if you have kidney problems, and especially if you're taking the drug metformin. I'd like to tell you a story about an HSG you will not soon forget. A friend of mine is a radiologist, and he was going in to do an X-ray at the hospital. In fact, I was following him. He doesn't see well, he has Coke bottle glasses, and his patient had great trepidation about this particular procedure. So she went in, and he couldn't see well, so he's about this far away from getting the catheter in. It's very difficult to thread it up in the cervix sometimes. And so in Central Florida, we have these major thunder boomers, and the lights went out. And all of a sudden, this woman who was afraid to death clamped onto his head and was shaking him back and forth like a rag doll. And he came out, all of his hair was messed up, his glasses were askew, his shirt tails were out. He goes, I thought I had a stroke. He said, I thought I went blind and deaf at the same time. He told me I never went into radiology for hazardous duty pay, but I earned my stripes today. I want to thank you for joining me today on the Infertility Channel. I really appreciate the fact that more and more of you are subscribing. Please tell your friends about us. If you have any comments, please leave them below. If your comments are of a personal nature, email me. I will address those in future episodes, but I cannot answer those directly. Thanks so much. Again, tell your friends about us. I look forward to seeing you back here next week.